Hello and welcome to EyeMedics podcast, where we bring you trusted insights and latest treatments for your vision. I am your host Bindu, and today we're going to talk about a condition that is very common as we age. Yes, I am talking about age-related macular degeneration or AMD, but specifically dry AMD. To answer all our questions about dry AMD and more, we have with us today Ms. Shakti Thakur, lead consultant and medical retina specialist at EyeMedics. Welcome, Ms. Thakur.
Morning. Thank you so much.
So let's get started. What exactly is dry AMD?
So this is a chronic condition, a long-term condition, typically affects the older age group. So we're talking 60s upwards generally. And what happens with age and a whole result of processes, abnormal biochemistry, slowing down of cell mechanisms, deposition of abnormal proteins and fats, is that you have little areas of tissues that start to degrade. So you have pockets of lost tissue, typically in the central part of the retina, that's called the macula. So as a result of that, it's like losing pixels in the center of your TV. So the central vision becomes patchy, loss of focus. So whatever you're trying to look at may start to become blurred, difficulty with reading, daily tasks, etc. And actually, alongside that, or even before that, you can have what we call delayed dark adaptation. Now, that means that if you're going from somewhere where the light is very bright, maybe from, very sunny outdoors to indoors, or where you're driving at night and there's a bright light, a headlight that comes at you, it takes much longer for you to recover, for the peripheral retina to recover. So that's one of the earlier signs of AMD. But typically patients will comment on the central visual problems. So it's the central visual function that is disturbed. And that is a gradual process that tends to occur over many years.
Okay. So who tends to develop dry AMD, and are there any specific risk factors?
As I said, typically patients notice the symptoms in their 70s or 80s, but actually the early warning signs may occur much earlier. And if there's a family history, then that you may even develop the earliest signs, which is the drusen, the yellow dots. That's the deposition of fat and protein, yellow dots in the macula. In the 50s even. Family history may predispose. As we're living longer, these conditions are becoming more widespread, a concern really.
Okay. So what you're trying to say is some of the basic symptoms that one should look out for are like yellow dots. There's a blurring of the central vision. Is that what it is? So
That's
if you
right.
were to point out 3 or 4 symptoms that patients should look out for, what would they be? The top 3, let's say.
I would answer that question a little differently. Okay, I would say that the most important thing is for patients over the age of 40 to have regular eye exams, because with dry AMD, many of the earliest signs won't have any symptoms at all. And the earlier the condition is picked up, the better, because the mistake that most people make are to leave it until many of the symptoms have developed, by which time it's very difficult to reverse the damage that is already there. The eye exams, retinal examination, accompanied by what we call an OCT scan, and that will show very precisely if there's what is going on. But the regularity of eye exams is the thing I would stress.
Okay, it's good to know that. The next question is the one that a lot of people ask us, or a lot of people wonder about. What is the difference between dry AMD and wet AMD?
Yeah, it can be confusing because the two things can often occur together. So dry AMD is this slow process, this degenerative process where you're getting pockets where the tissues are just wearing away. Wet macular degeneration is when you have abnormal blood vessels that are growing into areas of degeneration, and that can cause sudden distortion in the vision, sudden blurring, sudden loss of central vision. And that is treatable with injections that are given into the eye on a regular basis. But because the underlying processes are the same, so the underlying problem with blood flow to the eye, the abnormal biochemistry of these eyes as they are getting older, you can have the two things happening at the same time, or just one or the other, but the underlying problem remains the same.
Okay. My next question is, what are the treatments available for dry AMD?
The answer to that depends a little bit as to where you live on the planet. So in the US, there are intravitreal injections, so injections that are given into the eye. These are relatively new treatments where injections are given every month, every 2 months, complement factor inhibition treatments, PEP, Citalopram, etc. The rest of the world, there is no other standardized treatment that is available on a wide scale. However, the Valeda biomodulation device is probably one of the best non-invasive treatments that is out there. And the results from their studies, the light side studies, do show that as compared with patients who have the same condition and are not treated, it seems to slow the progression of the dry AMD. So there's a change in the anatomy. There's not so much build-up of the drusen. There's not as much progression of the areas of wear and tear. And 50% of patients actually notice a benefit in their visual function very soon after they start treatment. But I think one of the best things about it is that it's non-invasive, so it's no risk.
It's good to know.
At this point in time, there is a lot of research going on, looking at a lot of other options. But at the moment, these are the options that we have.
Good to know that. One of the questions we get all the time is, can dry AMD be reversed?
I'm not sure that I would use the word reversed. I think the best thing to say that it is that we can stabilize it. Maybe in 5 years, when we have results of some of these treatments and we're able to see how well they're doing in the longer term, we'll be able to comment on reversal. But I think the important message is, if you have intermediate AMD, then the thing to do is to try and start treatment, particularly something like a Valeda treatment, which is non-invasive, may be a very good idea, particularly if you are in the younger age bracket, because that gives you the best chances of keeping visual function in the longer term. Because once you've lost that central tissue, it's very, very difficult to get that back.
My next question is, what advice would you give to patients who are living with dry AMD?
So there's some simple lifestyle measures that we always tell our patients. There are things that affect the blood flow, the circulation, that we can do to help ourselves. Smoking absolutely must be stopped because it increases the risk, more than doubles or triples the risk, both for wet and dry macular degeneration. Obviously, it adversely affects the blood flow. Any cardiovascular risk factors the patient has need to be optimized. Again, that helps with the blood flow, so whether it's diabetes, high blood pressure, cholesterol. Keeping physically active, again, is really important. Maintaining normal body weight or reducing weight. All these things affect not only the blood flow, but also many things at the cellular level. So all those things are important, as well as dietary things. So we advise patients on the AREDS vitamins. There's another blog on that somewhere. But eating leafy green vegetables and a source of omega-3s such as fatty acids or flaxseed, those are all thought to be very helpful. The Mediterranean type diet, they're all thought to be pretty helpful in reducing risk. And of course, UV protection, because in the same way that UV is damaging to the skin, UV light is quite damaging to the retina, particularly when it's susceptible, when it's already damaged. So good quality UV protection is an absolute must.
You mentioned the Valeda system earlier during our conversation. Can you explain how EyeMedics uses this technology to treat patients?
The treatment is delivered in a cycle, 9 sessions of treatment. Each session is only sort of 4 minutes per eye. The technology uses wavelengths of the sort of longer wavelength end of the spectrum, which has been shown that the specifically activates the mitochondria within the retina and increases energy production and affects not only cellular energy, but affects lots of pathways that stimulate cellular regeneration. So that cycle is that 9 sessions, 9 very quick sessions over a 3 to 5 week period, and then having that cycle repeated ideally every 4 months in the longer term for optimal results.
Okay, good to know that. Now, as always, is my favorite part of the podcast, and that is rapid fire round. Should we get started?
Let's go.
Is dry AMD painful?
No, not at all.
My second question is, does everyone with dry AMD lose central vision?
People progress at different rates. The study from Belfast did show that if you have driving vision, then 2/3 of patients with driving vision lose that driving vision on average of 1.5 years from dry AMD. So the rate of progression does vary, but once it starts, it can progress quite rapidly.
Can dry AMD turn into wet AMD?
So the two processes can occur side by side. I wouldn't say turn into, but I would consider the two can coexist.
Does diet actually make a difference?
Yes, it's an important factor that can be modified. So yes, I would say it's an important factor to bear in mind.
Are there promising new treatments coming soon to treat dry AMD?
Loads and loads of them.
That's the end of the podcast today. Thank you for shedding light on dry AMD and all the treatments that are available. To our audience, if you have any more questions, to learn more about Valeda treatment, you can visit our website, EyeMedics.co.uk, or write into us. Thank you, Ms. Thakur, for answering all our questions today.
It's a pleasure. Thank you so much.
It's bye for now, and take care of your vision, because remember, your vision is worth protecting.